Knock, knock, knock. Hello, my name is Becky Lair. I'm going to be your nurse today.
Hi, I'm Desiree.
Hi, Desiree. How are you doing today?
I'm doing good.
Good. Well, today we're going to be doing a cranial nerve assessment on you. There's nothing to be nervous about. It's pretty easy. We're going to be staying around your shoulder area and up, mostly in your head area. I will have you walk a few paces for me when we get to cranial nerve 8, but other than that, it's pretty easy and it shouldn't take very long. So we're going to start with cranial nerve 1, and that is olfactory. Olfactory is going to test your sense of smell. So what I'm going to have you do, I'm going to have you close your eyes, and when I have you close your eyes, I'm going to have you occlude one nostril and then smell. Tell me what you smell. And this is all with your eyes closed. And then I'm going to have you occlude the other side and smell with that one and tell me what you smell on that one as well.
Okay.
So go ahead and close your eyes. Good. Smell. What do you smell?
Coffee.
Yes. Go ahead and swap sides. Close that one. Good. Inhale. Do you smell anything?
Yeah, still coffee.
Still coffee. Okay, good. You can open your eyes. You did good. Desiree was able to smell out of both nostrils, and she was able to identify that the smell was coffee, so that shows that cranial nerve 1 was intact. If perchance you weren't able to smell, I would ask you certain questions like, have you had a cold, maybe an upper respiratory infection, even if you were a smoker or a non-smoker or something like that. Okay, so moving on to cranial nerve 2, that is going to be optic, so we're going to be looking at your vision, and I'm going to have you read a couple of different signs. We're going to be using one eye, so you'll use your right eye with your left eye closed, and then we'll swap, and then you'll read a sign with both eyes. Okay? So I'm going to give you this little card you can cover your eyes with. Go ahead.
Normal, just a setting on the washing machine.
Very good.
I kiss better than I cook.
Very good. Now you can take that off, and we're going to read a sign with both eyes.
VHS, swimming and diving. Go Bearcats.
Very good. So Desiree was able to read all 3 of those signs. The first one with one eye covered, and the other one she covered again. And then her last sign she read with both eyes open and was able to do that with no problem. So cranial nerve 2 is intact. Now we're going to move on to cranial nerve 3 and cranial nerve 4. So cranial nerve, we're going to do 3 together. So we'll do cranial nerve 3, 4, and 5 together. Cranial nerve 3 is ocular movement. Cranial nerve 4 is trochlear movement, and then you have cranial nerve 6, which is actually abducens, and that's going to be the lateral movement of your eyes from side to side.
Okay.
So, but first, before I even get into that part, I'm going to do a little test where I shine a light into your eyes, and it's going to show me whether your eyes are equal, the pupils are equal and reactive to light. So I'll look and see if they're round, and then I'm going to shine my light into one eye, illuminate it, see if the pupil constricts, and that'll show that it's reactive to light. Then I'm going to shine my light in your same eye again to see if the other side that's not illuminated is going to react as well. And then we're just going to swap sides.
Oh.
Okay, so here we go. Just look straight at me. Very good. Now to the other side. Good. Very good. Also with this test, we're going to do what's called an accommodation test. So I'm going to have my hand out here, and I just want you to focus on my hand while I talk to you. And that's going to have your eyes dilate, so you can focus on this. And then I'm going to move that hand with just one finger towards your face, and then I want to see if your eyes react to that. And then I'll be moving that same finger to touch your nose, and you just follow that finger all the way to your nose, okay?
Okay.
Here we go. Very good. So Desiree's, her pupils were round and reactive to the light. I'd say that they were round at about 5 millimeters, and they both were the reactive to light, both the illuminated and the unilluminated. Both eyes were able to accommodate, and so that would take care of the accommodation and the round reactive to light portion of this test. Now we're going to move on to movement. And what I'm going to do is I'm going to shine my light, and I'm going to go in a upward a downward, and a diagonal motion. And I just want your eyes, only your eyes, to follow that. So keep your neck still, keep your head still, no movement of this, just follow my light with the eyes. Very good. Desiree was able to follow the light with her eyes. She showed smooth movement in both eyes at the same time simultaneously. There was no nystagmus or anything like that, so that shows that cranial nerves between her eyes being round and reactive to the light, and the accommodation, and the ocular movement we just tested shows that cranial nerves 3, 4, and 6 are intact. Now we're going to move on to cranial nerve 5 and cranial nerve 7. So cranial nerve 5 is the trigeminal. What I'm going to do is I'm going to use these little cotton balls, and I'm going to do it's kind of a light skin sensitivity test. And once again, I'm going to have you close your eyes, and I'm going to rub this little cotton ball on 3 areas of your face. And I want you to tell me any way you can, whether you say now or I feel that. Let me know when you feel that, okay? Okay, so Desiree was able to feel the cotton ball on her forehead, and on the opposite side on her cheek, and then on the opposite side of that down on her left jawline. So that shows that she was sensitive to that light touch. I'm also, let me finish up this one. I'm going to touch the back of her masseter here right below the tragus. Go ahead and clench your teeth. Good, and I can feel that in the back of that masseter. That muscle is flexed. And I'm going to try to open your mouth. They'll let me do that. So Desiree shows good strength in that masseter muscle, showing that cranial nerve 5 is intact. So moving on to cranial nerve 7, we're going to look at the movement of your face, the different facial features. So I'm going to have you, let's see which one we're going to do first. Go ahead and squint or close your eyes really tight. Okay, go ahead and open them. How about you raise your eyebrows real big. Now make like a furrowed brow. Very good. And can you smile for me? Very good. And how about puffing your cheeks out? Big puff. Okay, very good. So Desiree was able to follow those instructions. She was able to raise her eyebrows and close her eyes tightly. She also was able to smile, big smile, and puff her cheeks out with no problems. So showing all those facial movements, and they were symmetrical on each side, showing that cranial nerve 7 is intact. So this is the one, so I'm going to go on to cranial nerve 8, and I'm going to come behind you in this one. And what this one does, cranial nerve 8 is acoustic, and it is going to help us test your hearing, assess your hearing and your equilibrium. Another word for it is vestibular-cochlear. So the cochlear portion is the hearing portion, and the vestibular is I'm going to have you walk, and I'm going to observe your gait. So for the first part, I'm going to come behind your chair, and I'm going to have you occlude one side of your ear, and I'm going to whisper something in the opposite side that's not occluded. And then I'm going to have you tell me, or tell the audience what those 3 words were. And then we're going to go and do that same thing on the other side. Okay? Okay, so go ahead and close your eyes. And occlude your right ear. There you go. What did I say?
Your room is dirty.
Very good. Okay, go ahead and occlude your left. What did I say?
Care.
What did I say?
I don't care.
Very good. Okay, so go ahead and stand up. And I'm going to move the chair. You stay right here. Step back a little bit. Okay, and I want you to take 4 steps forward, turn slowly, and step back. 4 steps. Very good. Very good. Okay, hold on. Let me pull the chair up so the camera can see us. Go ahead, sit down. Desiree was able to walk very smoothly. Her gait was fine. She turned without any kind of problems in her stability. So that is showing that the equilibrium portion, the vestibular portion of that test, she did very well at. Also, her hearing, when I whispered in her left ear, she was able to respond and tell me the words that I whispered in that ear, as well as on the opposite side, showing that her hearing, that cochlear portion of her cranial nerve 8 is intact. So let's move on to cranial nerve 9, 10, and 12. Once again, we're going to put a few together. So cranial nerve 9 is the glossopharyngeal. It's kind of a big word. Cranial nerve 10 is vagus, and then cranial nerve 12 is the hypoglossal. The first one I'm going to do, number 9, which is the glossopharyngeal, I'm going to have you open your mouth, stick out your tongue, and say ah, and I'm going to look to see if your uvula, that's that little dangly guy in the back of your throat, to see if it goes up with your soft palate. Okay? So open your mouth, stick out your tongue, say ah. Very good. And then will you swallow for me? Very good. So in swallowing, I'm checking cranial nerve 10, which is your vagus nerve. And then last one I'm going to have you do is the hypoglossal. And for that one, I'm going to, I've got to remember what I have to have you do for that one. Well, let me tell you first. Since you were able to swallow without any trouble, that shows that cranial nerve 10, the vagus, is intact. And then also when you were able to open your mouth, say ah, and I saw your uvula and your soft palate rise. Also, when your tongue was protruding, it was at midline, so that shows that cranial nerve 9 is intact. Now to assess cranial nerve 12, which is hypoglossal, I'm going to have you say, or just repeat after me, light, tight, dynamite.
Light, tight, dynamite.
So Desiree was able to say light, tight, dynamite without any problems. She didn't have any hoarseness in her voice, so that shows that that cranial nerve is intact. So last but not least, we're going to do cranial nerve 11. Cranial nerve 11 is accessory, and I'm going to have you shrug your shoulders. Okay, now I want you to do it again, and I'm going to put some resistance and go ahead and shrug them anyways. Keep going. Very good. Now will you turn your head to the left and to the right, just like you're looking over your shoulder. Very good. This time I'm going to put a little bit of resistance. You just go ahead and keep turning. Very good. Very good. So on this last cranial nerve 11 accessory, Desiree was able to turn her head with resistance, as well as shrug her shoulders with resistance, showing good muscle, and that one is intact as well. That concludes our cranial nerve assessment. Thank you, Desiree.
Thank you.